So to be able to do that, even if I did it only once in my life, would be so incredibly meaningful to me, and I would feel so privileged. But to have done it 650 times is, again, I almost don't have words for it. Okay, we're gonna give him a big farewell, okay? Okay. Alrighty, oh boy, this is wonderful. I'm so happy for you. I am the first generation, firstborn of two parents who came over from the Philippines in the late 1950s. My parents were very, they worked hard as people coming over from Asia. My dad received his degree in architecture and actually became a very successful architect. My mother stayed home with us, and she did occasionally work as an assistant to a very prominent general surgeon in Manhattan. So I grew up in Manhattan with two other younger siblings, and I was driven to do things that perhaps other children at that time were discouraged from doing, especially female children. And despite my wanting to break those glass ceiling barriers, I did receive some pushback from some of my professors along the way, but my parents always stood by my side. It was difficult, first of all, as a woman, okay, to be in the surgical field. It's much easier now, thankfully, but when I trained, it was not so easy. That said, most of my mentors were men, just by the sheer number of men versus women in surgery. And those mentors really encouraged me, supported me, and helped me, achieve everything I did. I am in a field that's even more focused than regular heart surgery. Heart failure surgery it's a whole different subspecialty. It requires more training. And so I accomplished all that because I had very good professors and mentors. Well, I am very fortunate in that I love what I do. And people are thanking me, patients, their families, for what I do. And it doesn't get better than that. So although most of the transplants happen nights and weekends, and it requires a tremendous amount of support from your team, a tremendous amount of stamina, your adrenaline is flowing because you're actually saving a life in my opinion, in such a significant way. I don't know that it gets any more impactful than putting a new heart in someone.
So we hear all the time as just regular people that diet, exercise keeps us going, keeps us well. What has been the common denominator between that you found with these 600 surgeries where you say, if they did this better, maybe their heart would have done better?
Well, the majority of patients that need heart transplants suffer from coronary artery disease. And so whatever you can do to decrease the risks of developing coronary artery disease or the progression of coronary artery disease will help you. So yes, diet and lifestyle, those changes for the better will be better for you with respect to not needing a transplant. However, there's a large number of patients that develop heart failure for reasons other than coronary disease. Some of it is genetics. And so if you have congenital heart disease and you develop heart failure, there's nothing much you can do to prevent that, with respect to diet and lifestyle. But since the majority of patients who need transplants do suffer from coronary disease, we try to advise patients to do the diet lifestyle changes. So after the patient goes to sleep, we wait for the phone call from the procuring surgeon at the donor hospital to let us know that the donor heart is a good one. And once we know that, we get ready to open the recipient and prepare the recipient for the arrival of the new donor heart. And when the donor heart arrives in our operating room, we do several checks, and then we remove the recipient heart and we implant the donor heart. The donor heart implant takes less than an hour. It's actually not that long. And there's really nothing better than looking at this new heart beating vigorously right after it's implanted. You know what the old heart looked like, and it's almost like a miracle to see this new heart. I would always say, really pumping like a rock star, and so it's a really amazing feeling. It's a great privilege, and that is part of the reason why we are so passionate about what we do, the whole team, because the whole team is in that operating room looking at that new heart beating beautifully. Then, after everything's done, after the implant's done, closure takes maybe half an hour. And the second really great part is after the patient gets to the ICU, to the open heart unit, I get to go and talk to the family. And I have to tell you, that's an amazing experience. That's another part of the journey where I feel so privileged. The families are so incredibly grateful. They're allowed, we have a special room for families of transplant patients because it's a long ordeal. The patients go to the operating room, they're there for several hours. Not uncommonly, families like to stay overnight, and so we have a special room where they can sleep. It's got a kitchenette, and they're made very comfortable there. And then the following day, when the recipient wakes up, and you see he or she, the emotion is just palpable, and not uncommonly, they start crying because it is, like I mentioned, overwhelming, sometimes to wake up and realize you've got a brand new heart.
And of course, there are some learning lessons where things doesn't always go well.
Mm-hmm. Sure. I mean, sometimes, thankfully, that's not too common. But sometimes patients are sick otherwise. Going into surgery with other organ systems, perhaps that might not, be performing where they should be. But we're very fortunate here to have very good survival rates compared to the national average. So, it's not common to see things not go right. This Newark Beth Israel has been a well-recognized center of excellence for heart care. And they've been on the best lists for years. Certainly for heart transplantation, we have had referrals in from other states. So we are recognized regionally, but we need to get the word out to Newark and the surrounding areas that this is probably one of the best kept secrets in the state. It's not just the excellent treatment and care by these physicians and staff, but it's also the compassion, okay, that exists here. One of the things I first noticed when I got here 16 years ago is that this place, the people are like a family here. And I mean from everyone from the environmental services right up to the CEO. I have heard numerous accounts from patients about how somebody will come in to clean their floor in their room and ask if everything's all right and make sure there isn't something they could do before they leave the room. And I got to see that firsthand when I brought my father here for 2 heart procedures. He had a coronary bypass here in 2008, and he had a percutaneous aortic valve done last year. Okay, he's 90 years old, and he's running around. He's actually out fishing today. So I got to see firsthand how a patient gets treated. And I know how restrictive it can be sometimes when you're in the hospital. Nurses are busy, et cetera, and you need something, but it's not urgent, so you'll wait. But if somebody who's taking care of your, cleaning your floor, whatever, comes in and asks you, is there something they can do? And there is something. I mean, that's just that extra special touch, and they go that extra mile to try to take care of the patient first. And to me, that's priceless. So the lack of enough donor organs has been a problem for decades. There are probably, I would guess, 60,000 people that could probably benefit from a heart transplant. And that's just a guess. We can never do more than 3,500 a year. This is all within the United States because of lack of donors. And so it is our responsibility as a program to allocate the organs, as best as we can. And what that means is you want to give that priceless organ to someone who will make the most of it and live the longest with it and have the most productive life with it.
And how do you decide that?
So that gets done at least on a weekly basis. We have a very comprehensive heart transplant selection committee meeting that involves over 30 people, 10 physicians, which include cardiologists and surgeons that focus only on heart transplant. We also have many nurses, social workers, all types of specialties at that meeting. And the decision is by consensus. So every patient that is a potential recipient is worked up with a punch list that has probably over 20 items. So it's an extensive workup because it has to be. And as a group, we listen to the presentation and we make a decision. And each presentation plus a discussion can take over 30 minutes. So these are very, but they're very comprehensive, but they're extremely important.